Thank you, Sahani sir and Dr. Manish. Good evening, good afternoon, and good morning. This is the 1583rd day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. VIREN NIMBARK. Let us begin the session with 1 minute silent prayer. Thank you all. As we end the year 2024 by tonight, and some part of the world, the new year has begun. And we wish you all a happy new year and prosperous new year, and hope homeopathy will become the first in the world in the system of treatment in the coming year onwards. As you all know, the International Forum for Promoting Homeopathy comprises of homeopathy lovers, students, and doctors. And we have 3 sessions every day. All these sessions are going in a good way. The first session of the day is already over in Hindi. That was an excellent session from Dr. Manish Azad. And the second session, which has begun at 8:30 and will end up in 9:30, the international session in English, and 9:30 to 10:30, we have a local language session in Malayalam. And the videos of the same will be uploaded on the very next day itself, so that you can watch it again if you are interested, as well as those who missed the session can also watch it, and you can share with your friends without paying any money. That is the beauty of International Forum for Promoting Homeopathy. Now you can search IFPH Homeopathy at YouTube to find the videos. Let me come to today's session. As you all know, today our guest is Dr. VIREN NIMBARK. He has completed his MD in homeopathy, working as Assistant Professor, Department of Surgery, Rajkot Homeopathic Medical College, Rajkot, Gujarat. He's a consultant physician, homeopathic, 8 years of academic experience. He has presented an abstract presentation in NOPCOM 2021, Nobel University, Gujarat. He is a resource person in webinar series by One Sambat Spondin in January 22nd. And he has done some presentation last week here, and that is Urolithiasis and its homeopathic management part 1. Today, Dr. VIREN NIMBARK will be presenting the second part of the same. That was an excellent session last time. Today, in this session, Doctor will be discussing the therapeutic aspect as well as some cases in his kitty. We proudly welcome Dr. VIREN NIMBARK for this session. Welcome, Doctor.
Thank you, sir. Thank you, Dhanesh sir, and all the team of the IFPH. I am heartily gratitude for being invited as for this different sessions. Now we will just get the few glimpses about urolithiasis, as we had also seen in the last session. Okay, so the first thing that in the cases of renal calculi, the anatomical structure of kidney is important. It consists with the renal pelvis, arteria renalis, major calyx, minor calyx. Again, the pelvis of both kidney are important, as it is also getting involved over the major calculus formation, and if the calculi is getting stagnant over the pelvis, then it could be also getting complicated as a staghorn calculus, that we will also discuss later on. This is quite an important animation that I had prepared. So while the formation of urine is occurred in the nephrons, each and every nephron is involved along with the different process of urine formation. Okay. Now, the different causes for the renal calculus, just a brief brief caps of the causes. The first thing, that is hyperexcretion of relatively insoluble urinary constituent. Those are the different chemical substances like oxalate, calcium, uric acid, cysteine. And if it is along with the drug induced stone, those drugs are also getting insoluble urinary constituent, and that is precipitated and causing the calculus. Majorly when the calculus is formed, it is along with the center of the pus or the particular cell debris, and then further on it is getting precipitated all through with this any one or more than one insoluble urinary constituent. So that is the major thing for the formation of renal calculus or urolithiasis. It also getting occurred along with the physical changes in the urine, that urinary pH is increased. There is also the colloid content in the urine. There is decreased concentration of crystalloid, urinary magnesium or calcium ratio is getting altered. Altered urinary crystalloids and colloids, decreased urinary output of the citrate. Many a times vitamin A deficiency is also causing altered renal functions, and that's why it is also getting caused with the urolithiasis. Urinary infection is the major cause. Majorly in female patient, UTI, that is urinary tract infection, is getting involved along with the formation of renal calculus. Urinary stasis with majorly the bedridden patient, if there is a particularly urinary stasis occurred, it also causes renal calculus and hyperparathyroidism. In such a cases of hyperparathyroidism, the calcitonin is also causing the increased amount of the calcium in the excretion, and then further on it is causing the major precipitation of calcium. Okay, so those all are the causes. Types of renal calculi, two types majorly, primary and secondarily. Primary stones are oxalate calculus, uric acid and urate calculi. Whenever there is uric acid excess, it is causing the uric acid or urate calculi. Oxalate calcium oxalate stones are majorly the mixed type of the stone that caused along with the calcium and oxalate. Cystine calculi are very rare. They are also non-radio opaque, but pure cystine calculi are non-radio opaque. Xanthine calculi and indigo calculi are also rarely occur, but those are the congenital stones. So it is majorly found over the neonate and it could be easily differentiated. Requirement of the radio-opaque stones to be identified particularly over the location, that is oxalate calculus. Secondary stones are phosphate calculus and mixed stone. This is quite an other animation. It also showing that particularly when the renal calculi is entered over the renal pelvis, it is also causing the pain. Otherwise, the stone is quiescent. Quiescent means there is painless condition. So, without any pain, the stone will lie dormant for a quite long duration. Uh, Clinically, there are four different types. The first type, that is quiescent calculus, that just discussed. The stone will lie in the particular renal calyx and it does not cause any kind of the pain. It is increasing in the size and it is also causing the destruction of the renal parenchyma during that particular quiescent period. Then there is starting of the pain. Majorly, whenever the stone will move slightly, it is causing the pain, and that pain is also over the two particular part. The first thing, that is renal angle. Renal angle is posteriorly over the lower margin of the floating rib, and just in front there is a renal point that is medial to that and it is around the ninth rib. So the pain, fixed renal pain, that is situated in the renal angle posteriorly and in the corresponding hypochondrium anteriorly, that is known as renal point. So that fixed point is very important and to be understood along with the pain over the ureter. Whenever the stone will enter inside the ureter, it is causing the ureteric colic. That is radiating of the colicky pain due to the reflex pain which takes place along the course of the ileohypogastric and ilioinguinal nerves, which are the somatic nerves of the same segment. So these both nerves are supplying over the other different organs, as well as it is also supplying the ureter. That's why the pain is transferred along with the loin to the groin. Okay, so that particular flank, if the stone is over the left side, it is causing over the left renal flank pain, and if it is over the right sided pain. Many a times it is also causing the bilateral pain. So that ureteric colic is very much important, and that is also radiating pain through the course of the ureter. That particular pain might be also affecting over the scrotum or labia majora or up to the pelvic organs as well, because it is the same nerves. Those are the same nerves which are supplying over the pelvic organs as well. So the ureteric colic, that is referred pain, is also affecting along with the all over the abdomen. So the third type of the pain, that is referred pain, that is rare and is sometimes referred to all over the abdomen. Hydronephrosis. There is intermittent hydronephrosis. So in case of the renal calculus, first there will be the starting of hydronephrosis, that is also causing the pelvic lump. There is also pain over the ureter whenever there is hydronephrosis, that is accumulation of fluid in the ureter. It is causing along with the pain. The fluid is also accumulated over the pelvis, over the kidney, and then further on that particular Okay, so that particular swelling is also causing the dull ache. That pain is occurred over that particular region. But what happens whenever the ureteric stone, that the stone will getting stuck over any particular portion of the ureter, if it gets stuck, then it is causing that hydronephrosis as the localized pain. That pain is not referred to the loin. That is the referred pain is getting stopped, and that localized pain is also getting delayed, getting decreased of the intensity over the few days. So almost after 1 to 2 days, if the pain is stopped, it is causing the total malfunction, that the kidney had stopped functioning because of the hydronephrosis. Fluid is getting accumulated over and over, more and more fluid is accumulated, and that's why the kidney had stopped functioning, and it is getting more and more complicated. So that if the pain is stopped, it is not a good sign unless and until it is along with the medication. Okay, so that is the hydronephrosis. And hematuria majorly after strangury. We need to know about the term strangury. Strangury is the term whenever there is excessive straining for the micturition. If the patient tries to strain excessively for the micturition, it is known as strangury. But in the case of hematuria, if the stone is getting stuck over the ureter or urethra, then the hematuria will be excessive, because the strangury is also getting causing that injury over that particular parts. Otherwise, it is usually occurs in a small amount to make the urine dirty or smoky during or after an attack of pain. So those are the symptoms. Now over the signs. As we all know that the symptoms are subjective, and now the signs which are to be understood as the objective. So the physical signs, the first thing, that the tenderness. This is mostly present at the renal angle posteriorly, as we had just discussed about the renal angle, that is between the lower border of the floating rib, 12th rib, and the lateral border of the erector spine muscle. Particularly over one point, there is tenderness, that is eliciting pain over the palpation. Anteriorly, such tenderness may be elicited about an inch below and medial to the tip of the ninth costal cartilage, which is known as the renal point. Muscle rigidity over the kidney may be found in a few cases, that is rebound tenderness anteriorly, which can be elicited particularly if acute infection is associated. Muscle rigidity should be along with that particular part of the kidney. If again the either side of the kidney is getting involved, and that rebound tenderness is particularly pain over the palpation of that particular side. Swelling when there is hydronephrosis or pyonephrosis. Pyonephrosis, that is pus formation in that particular affected kidney associated with renal calculus. A swelling may be felt in flank. It is oval or reniform in shape. That over that particular region in that flank means lateral side, either lateral side or over the back, there will be oval swelling which is along with the associated with the intensity of the hydronephrosis or pyonephrosis. The swelling is almost fixed and cannot be moved as it is retroperitoneal swelling. Kidney lump is ballotable. If it is kidney lump, then it is ballotable, otherwise it is getting fixed. The swelling slightly moves up and down with respiration, but much less than a liver swelling. Fingers can be insinuated between the lump and the costal margin, which is not possible in the splenic or liver swelling. As in the kidney swelling, it is because of the hydronephrosis. Majorly, it is along with the hydronephrosis. So, that is possible over the pressing up along with the fingers. Otherwise, in the splenic lump or the liver lump, it isn't possible. A band of resonance can be elicited anteriorly on percussion due to the presence of colon. Gas-filled colon is causing the resonance band. Duodenum and coils of small intestine in front of the kidney according to the site. But such resonance is absent in the other swellings. Abdominal distension and diminished peristalsis may accompany the ureteric colic. So those all are the signs which could be also examined over the patient. If the patient is having the chronic renal calculi or chronic urolithiasis, in such a cases, those lump are also persistent and it may be complicated further on. Now, the special investigation, blood investigation specifically for the blood urea, non-protein nitrogenous content and creatinine. Creatinine is the substance which is excreted with help of the urine. And whenever there is rise of the creatinine, the first indication of the damaged renal function is along with the rise of creatinine. So that's why the NPN and creatinine along with the blood urea is required to be measured. Okay, so majorly the renal function test by estimating the blood urea, non-proteinous nitrogenous content of the urine as well as the creatine. Urine analysis. Renal function test should always be performed in the calculus cases. Whenever there is increased amount of the uric acid, urea, that will be precipitated as the uric acid stone or the urate stone. Whenever there is increased amount of the calcium or magnesium, it is causing the calcium oxalate stone. Radiography, the straight digital X-ray, which is very revealing about the kidney, ureters and bladder region, and straightly it will give the identification about the size, shape, location of the renal calculi in the cases of radiopaque stones. Excretory urogram, that is very much important if the stone is getting stuck either in the ureter or the urethra. Ultrasonography is also useful, and majorly along with the operative measures, the USG is also getting performed. CT scan is majorly useful whenever there is cystine stone. Okay, renal scan, in instrumental examination and the examination of the stone. If the stone is getting excreted, that prior stones are also required to be examined to have an idea that what could be the recurrence of the urolithiasis. Now the different surgical aspect of renal calculi, that is the extracorporeal shockwave lithotripsy, that is nowadays majorly useful to remove the particularly stones from the kidneys. Percutaneous nephrolithotomy, that is PCNL, and ureteroscopy, that is URS. These three surgical procedures are majorly performed. Okay, but majorly there is ESWL, that is extracorporeal shockwave lithotripsy is performed. This is one of the animation for ECSL or ESWL, that the instrument is placed just beneath the kidney, then the waves getting struck to that particular stone is getting crushed, and then it is getting excreted. Okay. I will just move over the next surgical procedure. There is PCNL. It is also the minimally invasive procedure to remove the stones from the kidney by a small puncture wound up to 1 centimeter through the skin. It is through the particular posterior aspect. So the approach is getting lumbar approach is getting from the posterior aspect. It is most suitable to remove the stones of more than 2 centimeter in the size. Otherwise, ESWL is getting preferred. Okay, and many a times it is also getting performed along with the ESWL. Okay, nowadays the stone is, if the stone is quite large, it is also getting broken along with use of the ultrasonic lithotripper. Okay. This is also an animation for the PCNL. So it is through the approach, direct approach through the posterior aspect, and then it will break the stone as well as it will also suck the stone, the remaining particles, remnants. Okay. Majorly in the cases of the ESWL, the hematuria is complicated as per the ESWL, the waves are getting struck to the particular stone, but it is also getting struck to the renal parenchyma as well as the surrounding portion of that particular kidney. And because of that, it will also damage that few other portions of the kidney, and that will be followed with the hematuria for few days. That is the major complication of ESWL. And the different other type of the open surgeries that is also getting performed if the stone is very big. It is also getting complicated like the infection, or getting complicated like the mixed stone. Then over such a cases, the open surgeries are also suggested, open surgeries are also required. In so different type of the surgeries, the pyelolithotomy, that is whenever the stone is getting stuck over the pelvis of the kidney, and then it is removed with that posterior approach over the pelvis of the kidney. Nephrolithotomy, that is the parenchymal approach to that particular kidney and the stone is removed. Pyelonephrolithotomy, that is the combination of both of it. Partial nephrectomy, whenever the stone is getting stuck either over the upper or lower pole, and then further on it isn't getting removed. Over such a condition, if there is emergency cases, the partial nephrectomy is performed. Nephrectomy and nephrostomy. Nephrectomy, that is the removal of the particular portion of the kidney. And nephrostomy, it is. Now over the cases, the management is also many a times the false reoccurrence along with the tiny stone that is getting overlooked at the time of the operation. So if the tiny stone remnant are remained inside the kidney, over such a cases it is required, it is getting reoccurrence. So that is false reoccurrence. Because of that particular limitation, the stones had tiny stones had remained inside, and then it is getting reoccurred. True reoccurrence, that the patient with renal stone is usually liable to produce further stones subsequently. Attempts should always be made to prevent such reoccurrence, or for the prevention of reoccurrence. Again, the patient should be particularly advised to take the abundant amount of the liquid water, particularly almost up to 2 liter of water is required daily to prevent the reoccurrence of the stone. The patient is also required to have the restricted diet majorly if the patient is non-veg, and over such a cases that particular non-vegetarian food is also getting with the formation of the stone. So all those are also getting advisable conditions to prevent the true reoccurrence. All patients with renal stone don't require surgery when the stones are sufficiently small. This can be naturally eliminated. Expect the policy. Okay, so now over the homeopathic treatment for the urolithiasis. First of all, we all knows that for the homeopathic approach, we need to have that whole case, that the patient as a whole as well as the constitutional medicine. So thus the reoccurrence is getting prevented. First of all, if the patient came with the acute episode, that acute pain is required to be subsided. In our previous session, we had also discussed few medicines to subside that acute episode. That acute pain, if it is over the renal angle, then it is majorly over that particular kidney only. That means that the stone is lying in the kidney and then further on it is causing the pain. But if it is referring to the different organs or referring up to the urinary bladder or the pelvic organ as well, then it is suggestive of the ureteric stone, that the stone had entered inside the ureter and then further on it is getting along with the painful condition. Those are also the major chances. And in both of the conditions, there are the different medicines which are very much helpful to limit that painful condition. It is just like immediate condition to stop that pain, and then further on the treatment is getting managed along with the homeopathic medicines. Further on, the homeopathic medicines are selected along with the individualization, examination, and case analysis, which include the medical history of the patient with the physical and mental constitution. In such a case taking, as we are dealing with the urolithiasis, that the particular aspect along with the excretory system is also required to be asked to the patient, like the character of urine, frequency of urine, if there is any strangury, how many times the patient has to pass for the micturition in day, night, or further on any complication. Likewise, the case taking is also required, as particularly over the urolithiasis. The particular local examination is also required in the cases of urolithiasis, that the examination should be apart with the kidney, that is over the lumbar region, that particularly for the lump, if there is renal mass or the renal lump that is ballotable or it is also getting easily uh, getting pierced along with the finger, then it is always with the hydronephrosis. So intense hydronephrosis or pyonephrosis is also getting involved, is also getting complicated, so it should be treated along with that. So that might be the cystitis or further on complication over such a cases of urolithiasis. A miasmatic tendency is also often play an important role for choice of remedy for chronic condition. Majorly the psychotic tendency, uric acid diathesis, all those are required, that particular choice of the medicines. The symptoms listed against each medicine may not be directly related to this disease, because in homeopathy we have the general symptoms and constitutional indications which are also taken into account for selecting a remedy. With example of lycopodium, as we all know that lycopodium has the craving for the warm food and drink, like it also have the craving for the sweet, so it isn't directly related to the urolithiasis. But to know about that the physical general symptom or the particular general symptom of the patient, it is required to know about that aspect as well. We will just now discuss about the few medicines. The first is sarsaparilla. It is also known as wild licorice and the family is Smilaceae. It is used for the dark head people, and I will just directly came to the characteristic symptom, that is the passage of gravel at the conclusion of urination with severe, almost unbearable pain. That is the first medicine of choice whenever there is pain at the conclusion of urination. That is getting followed with the strangury. If the patient has the strangury with that severe, almost unbearable pain at the conclusion of urination, sarsaparilla is the best medicine. Berberis vulgaris, equisetum, medorinum, thuja are also required to be differentiated, as the medorinum and thuja both are the antipsychotic as well as the best medicine indicated with the excretory system. Berberis vulgaris and equisetum are directly affecting over the excretory system. Bloody urine, stone in bladder, urine, characteristic of urine. Now, this is also the important portion that we are majorly missing the characteristic of urine, as the patient are also many times non-observing that characteristics of urine, and it is also required to know about the urine, that how much there is deviation from the normal. Urine, if it becomes bright and clear but irritating, scanty, slimy, flaky, sandy, and copious, passed without sensation, that is also characteristic of sarsaparilla. That at the conclusion of urination, there will be severe pain. There is painful distension and tenderness in bladder. Urine dribbles while sitting, standing, and passes freely. Air passes from urethra, sand in urine, or on diaper. The particular fragments of the stone that will be also passed. The same is also lycopodium. But the difference in the sarsaparilla, that sand is quite a paler in color, but in the lycopodium there is red sand on urine. Okay. Child screams before and while passing it. So that's why it is also getting differentiated with lycopodium. Sand in urine or on diaper, and child screams before and while passing. It is also useful with the checked gonorrhea by the cold wet weather or mercury followed by the rheumatism. Sarsaparilla, many times the urolithiasis or renal calculi associated with rheumatism. There is also excruciating pain from the right kidney downwards. That is the course of the right ureter, which is following the pain over the sarsaparilla. That is the lycopodium is also indicated. So this both medicines, sarsaparilla and lycopodium, along with the medorinum and thuja, are required to be differentiated. Intolerable stench on the genital organs, fluid pollutions, bloody seminal emission. So those all are the psychotic tendency in the sarsaparilla. Now the cantharids. It is also many times used for the urinary tract infection. UTI is also getting handled very good along with use of the cantharids, especially in the female patient. Otherwise, in the excretory system, there is the hemorrhage. Pain is raw, sore, burning in every part of the body, internally and externally, with extreme weakness. The burning pain and intolerable urging to urinate is the red strand of the cantharis in all inflammatory affection. There will be majorly the cystitis, urinary tract infection, along with the urolithiasis. That is the keynote for the cantharides. Disgust for everything, drink, food, tobacco, drinking even small quantities of water increases pain in bladder. That's why there is disgust of everything. Constant urging to urinate, passing but a few drops at a time, along with the strangury, which is mixed with blood, sudden desire to urinate, and intense itching in urethra. Intolerable urging before, during, and after urination, violent pain in the bladder, burning, cutting pains in the urethra during micturition, violent tenesmus and strangury, erythema from exposure to sun rays, that is sunburn. Many a times it is also associated with urolithiasis. So that is cantharids. Okay. Now Berberis vulgaris. The renal or vesical symptoms predominate in the cases of Berberis vulgaris. It is prepared from the berberry and the family is Berberidaceae. Pain in small of back. It is very sensitive touch in the renal region. So whenever the doctor will just try to touch, the patient will elicite along with the pain. That is in the case of Berberis vulgaris, aggravated when sitting and lying from the jar from fatigue. There is burning soreness in region of kidney with the numbness, stiffness, lameness with painful pressure in renal regions. Burning, soreness, numbness, and lameness. We are also just remembering it with BSNL. Burning, soreness, numbness, and lameness. That lameness is particularly derived along with the non-functioning, as the part is non-functioning, as the part is so much weak that the lame feeling is felt over the renal region. In the cases of Berberis vulgaris as well. There is rheumatic and gouty complaints with the diseases of urinary organs. There is stitching, cutting pain from left kidney following the course of ureter into the bladder and urethra. Tabecum, and the same thing is seen over the right kidney in lycopodium. These all are the referred from the different reference books by Dr. S.R. Phatak, by Dr. Borik, likewise. Renal colic is more over the left side. In the cases of tabecum, there is either side. There is also renal colic with urging and strangury, which is seen in the cantharis we had just discussed. In the cantharis, there is particularly more marked urging and strangury. In case of Berberis vulgaris, there is always with the burning, soreness, numbness, and lameness. These are the characteristic, along with the cutting pain from the left kidney following the course of the ureter into the bladder and urethra as well. There is a rubbing sensation in the kidneys, which is equal to the meadorhinum. Character of urine, that is greenish, blood red with thick slimy mucus. So it is quite different from the sarsaparilla. In sarsaparilla, there is slimy and quite a paleness which is seen. But in case of Berberis vulgaris, it could be greenish or blood red, or it could be also transparent, reddish, or jelly-like sediment. That is in case of Berberis vulgaris. And movement brings on or increases urinary complaints. Now the next medicine, lycopodium. The characteristic of lycopodium that is well known, that is the red sand in urine on the child's diaper. Child cries before urinating. Pain in back which is relieved by the urinating, that is followed after the strangury, that the child strain for the urine and only few drops along with the red pigmentation, red sediments is passed, and then it is relieved for some time. Renal colic specifically for the right side, left side is indicated for the Berberis vulgaris. Pain is extending along with the ureter and ends in the urinary bladder. Backache ameliorated by the urination, lithic acid in urine. Lycopodium also having the physical general, that is the characteristic physical general, desire for the sweets and hot drinks. All the symptoms are aggravated during 4 to 8 pm. Patient is hungry but fullness after a little food and distension of abdomen. That's why the patient must loosen the clothing. So those all are the symptoms of the lycopodium along with the in general picture of lycopodium. The patient is indicated in the cases of the urolithiasis. Okay, hydrangea. A remedy for gravel profuse deposit of white amorphous salt in urine. If there is profuse abundant amorphous salt in the urine, salt is so much smoky urine that it is indicated for the hydrangea. Calculus, renal colic, bloody urine, it acts on the ureter. There is also pain in the lumbar region. Burning in urethra and frequent desire, urine is hard to start. There is heavy deposit of mucus, sharp pain in loin, especially over the left side. Hydrangea is also known as the breaking the calculus. If there is very large calculus, that pararia brevia or hydrangea, these both are the indicated to break that calculus. Okay, if it is more than 1 centimeter, many a times Pararia brevia is also indicated over that particular choice of the medicine is only for that breaking of the stone. Then further on, the other constitutional medicine is indicated. Chimaphila is also a small medicine, but many a times it is useful for the urolithiasis, one of the medicines where the symptoms point to its employment over the bladder affection. With the catarrhal condition, there is unable to urinate without standing with feet wide. That is characteristic of Chimaphila. If the patient came with such a characteristic symptom, it is getting indicated. Urine is turbid, offensive, containing ropey or bloody mucus. Otherwise, the blood is mixed with the urine, that is hematuria, but in that case, in the case of Chimaphila, the ropey hematuria is characteristic. There is also depositing a copious sediments. There is burning, scalding during micturition and staining afterwards. Must strain before flow comes and scanty urine. Those all are the characteristic of Chimaphila pararia, as we had just priorly also discussed. It is useful to break. It is also known as stone breaker. The urinary symptoms are most important. It is useful in the renal colic. Also, it is useful for the prostatic affection as well as the catarrhal condition, inflammatory condition of the bladder, cystitis. Sensation as if bladder were distended with pain. Okay. Other medicine next to pararia, that is Urolithiasis. There is cystitis with bloody urine, chronic vesical irritation with pain and tenesmus, catarrhal discharges, burning after the discharge of the slimy urine, pyelitis, frequent urging with severe spasm of bladder, burning and tearing pain. Urine contains blood, pus, and much of the tenacious mucus with clots in the large masses. There is involuntary micturition, green urine, or dysuria, painful micturition. Okay. This is the first case of mine of urolithiasis. I have also saved it. That the patient came along with the bilateral renal calculi. Okay. There is almost 4 millimeter of the renal calculi in the middle calyx of the both kidney, and otherwise it is having that particular painful condition over the micturition. The patient is also suffering from the renal calculi prior, and he had also getting operated prior. There is also the ECSL or ESWL, and he had uh, performed it over the 2016-17, and then again he came along with the uh, two renal calculi in the 2018. Now then he just referred that again the ESWL is required, but he planned to take the homeopathic medicine, and after prescription of the Berberis vulgaris and Lycopodium along with the different phases, that the first prescription is getting along with Berberis vulgaris, mother tincture is given 10 drops BD for the 1 week, and then further on it is getting followed with the 3 doses of Lycopodium, and then he is on the SL. But he had not just filtered that urine, otherwise I will also collect that renal calculi. But after almost 15 to 20 days he is totally relieved along with the uh, painful condition, and then I have also requested him to perform the again X-ray KUB that will be totally normal, and the lumbar spine under so that X-ray KUB is getting normal. Okay, so that is the first case. Then further on, there are also the many other cases which have came along with the urolithiasis, as it is also known as a stone belt, stone region, along with reoccurrence of the kidney stone. As per the groundwater is getting used for the drinking water, so there are the major chances for the renal calculi, and that's why there are infrequent conditions of the renal calculi are getting performed over the Gujarat as well as the other regions like the Rajasthan is also getting suffering from the renal calculi. There is infrequent occurrence of the renal calculi. So over such a region, the homeopathic medicine is very much useful to prevent the reoccurrence, as well as it will also useful if there is a constitutional or diathesis which is prevailing over the urolithiasis. So that's all. As
Thank you, Dr.
so,
VIREN
yes,
NIMBARK.
Nimbark,
Yes,
Nimbark.
NIMBARK.
Okay, sir. Okay, okay.
NIMBARK. VIREN NIMBARK. Okay,
Yes, yes.
it's really a very good session, and you covered all the part of this uh, urolithiasis, management of urolithiasis with homeopathic medicines, and all the symptoms, particularly the therapeutics on each and every medicine was described beautifully. We as homeopaths usually get a different type of urolithiasis case, particularly single case, large case, a large one. It may be in the kidney, sometimes in the ureter, and at times it may be in the bladder, and at times it may be in the genital organ itself. So, in all those conditions, patient may feel different type of pain and different kind of things. We have to take the case in detail to find what is the remedy coming out of that. Particularly, there are certain specific also, some people used to say, but in our veterinary, it is written very well that if it is on the right side, so this much of medicines are good, doing well, and if it is on left side, it can be on this much of medicine. And if it is shifting from right to left, some remedies are very specific. But people used to come and say that, doctor, I used to take a lot of water, but still I get this disease. So that can be, we can consider that as a symptom rather than just an observation. But some people believe that it is not because of not taking as much of water. But actually, homeopathy perspective is entirely different. It is what we have seen is that when there is some stress in the person, there is every possibility of formation of these stones. If that is the that is why we used to say that the mind is very important in all case of diseases, whether it be urolithiasis, fibroid, or prostate, whatever may be. What's your opinion on that, doctor?
Yes, sir. As there are also the constitutional medicine that just missed, but the psychotic tendency, that is fixed idea, which is majorly many a times it is the psychosomatic tendency, that whenever there is fixed idea, or that particularly if the patient is getting towards that one direction, or only along with that psychotic tendency, it is also getting developed that further on more and more reoccurrence of the stone is in that particular patient, like the just like the medorinum thuja. There is also a few other medicines like calcarea carb, which are very much indicated over the removing that constitutional tendency or the reoccurrence of the stone. If there is psychotic tendency with the particular patient with the mental aspect, in such a cases it is also required to be getting understand about that, and to have that in that conversation, the consulting is also required so much in such a cases, that the consulting mostly I am also preferring that the consulting like weekly, at least weekly consulting. If the patient came uniformly randomly on any time on any day, that I will also expect about it. But majorly on the weekly appointment is also required over such a patient to remove that particular psychotic tendency. By consulting, by more and more communicating, it is also getting freed from that psychotic tendency.
Yes, really, that's very important. The patient frequent consultation, and this is quite natural that whenever the patient get pain, we may ask the patient to remain stable with continue with homeopathy, but for that pain is an indication of this possibility of expulsion of the stone. There is no need of getting panic. In those times, we can manage our constitutional medicine as well as the acute medicines
Yes.
along with that. Invite
I
Dr.
have also
Madhu.
just seen Dr. Hariharan sir.
Yes,
He
yes,
had
yes,
also given the major indications over the past session. If he could also discuss some more ideas.
yes.
He had
Uh,
also suggested that like magnesium phosphoricum, majorly the magnesium phosphoricum is also many a times useful whenever there is acute episode of the renal calculi, as along with the sarsaparilla that MAGFOS 6x in the lukewarm water is indicated like the if over such a cases the acute phase is always must be followed with the constitutional, otherwise the next acute relapse will be more and more aggravating, like when the one acute episode is taken up with help of the particular medicine, but if the same patient is not given the constitutional remedy, then further on whenever the next acute episode will be occurred, it will be more intense, and many a times it is also getting more complicated.
yes, Dr. Manoj, you can add something more on
Thank
that.
you, Tanesh. Of course, nice presentation, but what is more important is that as homeopathy physician, we must give more stress to the homeopathy part. In almost all possession, we often see that what happens is that in 45 minutes, around 30 minutes, 35 minutes used for the general description, then last 5 or 10 minutes just rushing through the homeopathy part. That should be changed. What we are always looking, or the person in the platform is always very curious about the way you manage the case with our medicines. Nice person. Then about again this, as Dr. Ganesh mentioned, the miasmatic background is an important thing. Then regarding the borewell water, deep well water, see, which is often contains much calcium. That will also causing this problem. Then again the diet, the regimen, the drinking of water, it should be according to situation. You know the climate in North India is now very cold, really extremely chilly. Then now the amount of water should be low. At the same time, around temperature 45, 50 degree should be high. So according to people and situation should be changed. Anyway, nice presentation. Congratulations. Come to your platform regularly. Thank you.
Uh, uh, Thank you, Dr. Manoj. Those who want to participate in the discussion can please raise your hand. I invite Dr. Hariharan sir to say a few words on this presentation, if possible. If you are here, yes, please unmute yourself, sir.
Hariharan sir is there but not responding now.
Responding. Dr. Veeran, yes, have you ever used Amnivisnega for removing the stones in the ureter?
No
Or
sir, I have not used it.
yes, that's a very good remedy
Okay.
for example, if the stone is a big size, some people used to give silicia to break it down along with the constitutional medicine. And then if you give the Mavisnega tincture, it may dilate the big ureter to a little more, and thereby the stone it can easily pass through the kid from ureter to the bladder. This is some of the doctors are suggesting such medicines, but if you look at the mathematical also, you can see that also in that area. What's your experience with the Cantharis? Have you ever used the Cantharis for this?
Sir,
Cantharis is
majorly there are this the use of these limited remedies are mostly performed because if the patient is getting cured with the use of these medicines, I am not just going out of the box like that. Okay,
yes,
so
yes,
I'm just thinking that if the patient is getting cured with Berberis vulgaris, then I am also having the reliability over the Berberis vulgaris, this all few medicines likewise. Okay,
yes.
so
Some people begin the treatment with this like podium for right-sided cases and left for
yes,
left-sided cases, Berberis vulgaris.
Berberis vulgaris, yes, sir.
Some doctors
Like
suggested that these Berberis 10 on potency is giving very good result, particularly our president, Said sir, Ismail, you may be knowing, Ismail said sir. Sir is a person who always use hypertension in those situations.
Okay.
We have seen several
But-
cases of urolithiasis where stones were removed with our homeopathy remedies. Even
There is
patients.
also Limca book of record. I think it is from Gujarat, Gujarat in the city of Botad. I think one homeopath is also having that record of Limca book of record for the removing almost 28 millimeter of renal calculi. That is the biggest size of the renal calculi. Almost 25 to 28 millimeter stone had been removed.
Oh. Those
Yes,
things are while presenting this kind of presentation, try to bring such things to the public so that we can take these things as shorts and make it as a reel to show the world that homeopathy can do such wonder. Because in this arena, people used to say that homeopathy is a pseudoscience and it has no power to do anything. But we homeopaths every day get such cases cured with a remarkable success. Whatever be the case, there are no, even every homeopath find get at least one a successful case every day.
it will also bring the faith of public over the homeopathy. That is also required.
What kind of confidence your students have in the college with
Sure,
homeopathy?
sir. I am also teaching surgery in second year even, sir. That's why. Because from the beginning, if the students will get the confidence of taking homeopathy and they will be the major publisher of homeopathy.
Yes. It is high time to take our students into confidence that so that homeopathy will be a
Yes, sir.
winner, and show them that we people can do a lot of wonders with our homeopathic medicine.
And these all are the few different aspects that the surgery is prevented, and if the patient is if the patient is getting result with homeopathy, that without surgery, and he had also experienced the surgery prior, like I had just given the example of the case, he had given the surgery 2 times, and then the third time if the stone is removed, then he will be the happy, and he had also given the many few patients. Till now the patient is referred by him.
Okay, very good, very good. It is the time to wind up the session. I invite Dr. Ram Prasad sir to say word of
Thank you.
thanks. Thanks, Dr. Ram Prasad sir.
थैंक यू डॉक्टर धनेश जी, नमस्कार डॉक्टर मनोज जी, and everyone namaskar. Congratulations Dr. VIREN NIMBARK. Very nice presentation, excellent session. Describe the renal calculi, very good. Describe, and many kinds of medicine, sarsaparilla, berberis vulgaris. My experience, China 6 prevention of reoccurs जो है renal calculi 3 months, and Cantharis 6 is a very good remedy, and miasmatic remedy Thuja is a very important remedy. A psychotic nature of renal calculi. So very good session. Behalf of IFPH, Dr. VIREN Nimbark ji. Thank you again presentation. Very thanks.
Thank you, Dr. Ramprasad sir, Dr. VIREN NIMBARK, and those who attend the session in this evening for such a wonderful presentation. And hope all of you will be with us tomorrow for a presentation from Dr. Srinivasan. He will be talking about nurse andrology. That is, he's a person who always use nerve repertory, and he is coming out with different sections in that. So hope all of you will be joining in the same link tomorrow at the same time. Thank you all. Good night.